Acute rheumatic fever is a highly immune-mediated disease caused by untreated group A streptococcal pharyngitis. It's a classic step 1 topic, and here's what you need to know. In terms of pathophysiology, it follows the pharyngeal infection with group A beta hemolytic streptococcus, the Streptococcus pyogenes. It's an immune-mediated type 2 hypersensitivity reaction, so antibodies against the bacterial M protein cross-react with self-antigen, which is called molecular mimicry. This is going to lead to inflammation affecting the joints, heart, skin, and central nervous system. So the clinical presentation would involve the famous and classic Jones criteria. Let's remember the major criteria as a mnemonic. Jones and O will be a heart, okay? So Jones, J is joints, and we're gonna see migratory polyarthritis, large joints, and it's gonna resolve by itself. Carditis, the O will be a heart. Pancarditis, affecting the valves, mitral first, then aortic, then tricuspid. So J, O, which is the heart, and N, Jones, N, nodules, subcutaneous nodules over extensor surfaces. E, jaundice, would be erythema marginatum, which is an evanescent rash with like ring-like margin. Pseudohanchoria, which is involuntary movement of the limbs and the face. The minor criteria, minor Jones criteria, would be fever, arthralgia, increased inflammatory markers like ESR or CRP, prolonged PR interval, don't forget this one, and the diagnosis require evidence of recent group A streptococcal infection and 2 major criteria, or 1 major criteria plus 2 minor criteria, okay? In terms of late sequelae, we think about rheumatic heart disease, which leads to chronic valvular damage. In the early stage of pancarditis, we're gonna see mitral regurgitation. But in the late state, we're gonna see mitral stenosis, which is a classic finding in adults. Remember that the rheumatic heart disease is associated with Aschoff bodies, which are granulomas with giant cells. And also, I don't know exactly how to pronounce that, Anetko cells, wavy rod-like macrophages. In terms of diagnosis and laboratory findings, we have to remember that we need the evidence of recent group A strep, and we can confirm that with positive unstreptolizing O or anti-DNase B titers. In terms of treatment and prevention, we always think about penicillin, right? And it's IM benzathine penicillin G. It's for primary prevention in cases of strep throat, right? And also penicillin for long-term prophylaxis to prevent recurrence and also prevent the worsening of rheumatic heart disease if it's already in place. Okay, in terms of supportive treatment, we can use NSAIDs for arthritis and also for pericarditis. And in cases of severe pseudohanchoria, we can treat the patient with steroids. So step 1, key takeaways, Jones criteria, classic for acute rheumatic fever. It's a type 2 hypersensitivity reaction, molecular mimicry. Mitral valve is the most affected. In early stages of rheumatic heart disease, you're going to see mitral regurgitation. In late states, you're going to see stenosis. And penicillin is the gold standard both for treatment and prophylaxis, okay? So this is a high-yield infectious disease talk for your step 1. Make sure you know the criteria, the heart complications, and management for your step 1. Save this for review and share with your friends also studying for step 1.